So I have to declare my biases up front. Like Jay and Floyd, I have my bias with housing. So as somebody once said to me, well, actually through OHTN and all the work that we've done through the Positive Spaces, Healthy Places research, housing is health. But also, I wear slightly another hat along with Fife House as my involvement with the Ontario Nonprofit Housing Association. And that tagline is, housing is where all the issues are. Good, bad, or indifferent, that's where they reside. So that's sort of my context in this. We were posed, I think, 3 or 4 different questions in preparation for this talk today, but I'll quickly go through some of those key challenges. And one was the program, and I think has been identified earlier, program interventions and particular research at times exist in separate silos. And particularly when it comes to working with community and community-based agencies. And I have to say, in the discussions this morning, and I hope it comes up later on today, the particular piece around context is from a community-based agency perspective, and I think for everybody in the room, we work in partnership with clients and client-driven programming. And I haven't heard the client name used once this morning, so not a bad criticism, but I think research and the work we do is all centered on the client and the good health outcomes for our clients. As well, program interventions, as they exist in the larger context of healthcare system, is often overlapping and I think identified by a few others with other systems, particularly around poverty, housing and shelter, even food security. Those things exist in other contexts and I think need to be part of sort of the program science model. And complexity of interventions based on population specific. Obviously, we were focused on the HIV community here, but our HIV positive clients intersect with other different sectors and health systems, mental health, substance use, if you will, and it's particularly poverty, and increasingly in the past number of years, issues around aging and age-related issues and complexity of care. So they intersect both on the clinical but also on the social service side. And competition for funding and system coordination, we struggle, particularly from a community-based context, of patching together a robust program based on about, and my colleague Jay said, 6 or 7 different funders, each with different expectations on their outcomes, if you will. So it's hard to deliver an intervention program and patching it together with different funding sources. And also with those is different points of view and priorities and biases within not only the disciplinary, but also the program intervention. Also working across sort of HIV, HCV, and STIs. I know in Ontario there's certainly a move, particularly within the provincial government, of combining, if you will, and I'm oversimplifying it here, I know, HIV and Hep C programming, which does make sense at a front line, but it also challenges frontline agencies in delivering those disciplines. Most agencies we've heard, and is certainly the response in Ontario and certainly across Canada has been very much a grassroots response to addressing issues around HIV and prevention and service delivery, but also combining with a more clinical, if you will, approach at the grassroots level. It can pose some challenges of working together and what are the outcomes. The other piece of it is around research gaps and that sort of thing I forgot to put in here. There's been a lot of research, absolutely, around HIV and certainly a lot of research around housing and housing as an intervention in various ways. The current model in Ontario and certainly at the federal level we're hearing is a housing first model. I won't get into the great gory details of what that actually means, but when research is done in particular areas, particularly around housing and housing first in that case, it's not one size fits all. We heard the term cookie cutter. There's a fear, I think, and certainly a challenge to agencies that have a continuum of housing support or a continuum of care that they have to now fit into different flavors of the month, if you will, around, in this case, housing first. So it requires more discussion and meaningful dialogue, I think, with community agencies, implementers, and scientists, as well as funders. And securing knowledge, securing funding sources to augment, and I mentioned the multiple funders we have, is really pulling together different sources of funding to actually make the work happen on the ground. So when good research happens, again, I use the example of positive spaces, it is a challenge to actually use that research, and we've used it successfully, I have to say, but to convince funders with their own priorities and different priorities to make that work for us. And oftentimes it's cobbling together those different resources to put something together. And it does force partnership, which is not in and of itself a bad thing. But if the partnership really has to focus on certainly the science of it, but also the partnership within the sector to deliver the best and most excellent care and support for the client. And that should be our prime focus. Both at the federal and provincial levels, certainly funding has been frozen for the past number of years. My main funder, for example, is the Local Health Integration Network. It has been frozen for 4 years now. So when we try to implement new things or even make the case that research has given us of good health outcomes, it's a challenge to do that with a funder that has kind of restrictive or frozen services, if you will, or funding sources. However, I have to say in Ontario, or at least in Toronto, the Local Health Integration Network is looking more and more at healthcare and health services as a system issue, which is a good thing. And I must admit, give them credit that they have brought together different and divergent community-based and clinical-based services to what they call sector tables to come up with different plans and different opportunities to make an actual difference. So they are trying to diminish, if you will, or mitigate some of the siloed effect of funding, at least within their own area. And that's my 5 minutes, I think. So thank you very much.